15 states are now suing the Trump administration over cuts to federal school mental health funding, and regardless of where you stand politically, this case raises some important questions. Here's the basic issue. Over the past several years, schools receive federal grants to expand mental health services for students. Districts use that funding to hire counselors, psychologists, social workers, and other support staff. They built programs around the expectation that the funding would continue as originally approved. Now, the administration is moving to terminate or reduce some of those grants, arguing that certain programs may be tied to DEI initiatives that conflict with current federal priorities. The states filing the lawsuit argue that the federal government cannot simply pull funding that was already authorized and allocated. And honestly, that's where my concern begins. If the federal government believes grant recipients violated the terms of the grant, then identify the violation. Tell us specifically which state, which district, which program, and what action created the problem. That's accountability. What concerns me is when funding is suspended without clearly identifying where the alleged violations occurred. Because at that point, schools, students, and employees who may have done nothing wrong are caught in the middle. School systems don't make staffing decisions overnight. When districts receive grant funding, they hire real people. They create programs. They make long-term commitments. They build budgets around the expectation that the funding will be there. When that money disappears, it creates uncertainty not just for administrators, but for students who may be receiving services through those programs. Now, to be clear, none of this means the federal government should ignore grant requirements. If states or districts violated the terms of the grant, then they should absolutely be held accountable. But accountability works best when expectations are clear, violations are identified, and consequences are targeted. That's very different from broadly cutting funding and forcing everyone to figure out afterward what exactly went wrong. The courts will ultimately decide whether the administration's actions were lawful. But from a policy standpoint, I think there's a larger lesson here. If we're going to hold states accountable, we need to tell them specifically what they're being held accountable for. Otherwise, we're creating confusion where clarity should exist. This is going to be an interesting case to watch because the outcome could affect not just mental health funding, but how future federal education grants are administered across the country. Let me know what you think in the comments. Should the federal government be able to cut these grants, or should it have to identify specific violations first?